my name is Danielle Graver. I am the Educational Coordinator here at Munson Medical Center Laboratory for Specimen Collection. Today we are going to teach you how to draw blood. So we're going to do start to finish blood draw. I have my coworker Kristen who's going to help me out today, so we're not actually using any patients. So basically I have a few different techniques I'm going to show you, some things that we use to draw blood here on patients, and I'm going to take you through the start to finish process of how we collect blood on a patient here at Munson. So I'm going to go ahead and put my mask on and go get our patient. So first thing we do, we need to find our order. Registration registers our patients, and they sit out in the main lobby and they put the orders in the rack here. When the order is in the rack, we grab our paperwork and we go out and grab our patient. Kristen? Hi, how are you?
Great, how are you?
Good. You can have a seat right there in the chair for me. Next thing we're going to do is do our hand hygiene. Kristen, can you please tell me your full name and date of birth too, please?
Kristen Lewis, 21591.
Awesome, thank you. So then if I did actually have orders on Kristen, which again, she's just my lovely volunteer today, not an actual patient, I would go into our computer system right here. It's called SunQuest. SunQuest is the laboratory system that we use here at Munson for ordering, receiving, and modifying our labs. So at that point in time, I would go in and I would receive my test or order my test, and they would spit out little barcoded labels right out of this machine here. It's called our label blaster. So once I have my labels, which I can print out just a couple of empty ones here, the next thing I would do is make sure that my tests match my order. So it's called auditing so that we don't miss anything. And then I would come over and grab my gloves and ask your patient if they have an arm preference or if there's one that typically works better for them. The reason that we ask this on patients is some patients have limited availability to their arms as to what they can use. It could be from a kidney dialysis port, which is called a fistula. It could be from a breast cancer or anything like that. So Kristen, is there an arm that works better for you or one that you prefer I use today?
Does not matter.
Okay, great. Next thing I'm going to do is get out my tourniquet. A tourniquet helps restrict blood flow from the arm, and it helps the veins become more pronounced. So when we place our tourniquet, we generally are going to put it 3 to 4 inches above our preferred site. So if I'm going to use the elbow area, which is what we call the antecubital area, I'm going to put it kind of mid-upper arm here. If we had to draw her out of the back of her hand, we would want to do it about 3 to 4 inches or 4 to 5 finger widths above where we would go on the hand. So the hand is always a last resort for us. It is more painful and the veins don't tend to be as great there, but sometimes they don't have anything in their elbow area or the antecubital area, so we do have to go down to the hand. So I'm going to go ahead and put my tourniquet on Kristen and see if I can find a vein to pop up. Now with a tourniquet, you don't want it to be so tight that it's actually hurting the patient, but you do want it to be somewhat snug. If it isn't tight enough, it's not going to make your vein more pronounced and it's going to be a little bit more difficult to do your draw. So then the next thing I'm going to do is what's called palpating. You want to palpate across this way because the veins run vertically this way. So if you palpate horizontally, you can actually feel the different structures. So you could feel if there was a tendon or a ligament in there, which I definitely don't want to hit. That would be very painful. And when you push down on a vein, a healthy, resilient vein should actually kind of bounce back at you. When I draw children, I tell them it feels like gummy worms under their skin because I think that's just a great analogy, and that's what it feels like. So Kristen has a really good vein right here. Because I've talked for a few minutes, I'm going to release the tourniquet. Typically, we want to monitor our tourniquet time. Tourniquet time should be about 1.5 minutes to 2 minutes from the time you put the tourniquet on until the time you actually collect your blood sample. Longer tourniquet times have shown that we can increase certain analytes and fluctuate some of our results. So we want to be super cautious with that. So I'm going to go through and I'm just going to pick out my device really quick. The safest, we have a couple of different options. We've got a straight needle vacutainer, and then we have a butterfly that we can use with either a vacutainer or we can attach a syringe to it for more difficult draws. For Kristen, she's got a really great vein. The straight needle vacutainer is the safest that we have here at Munson Medical Center, and it's because of the safety device that is on it. It's a quick 1-finger click. and it is safest for all of our employees here. So then I'm going to go ahead and retighten my tourniquet now that I'm ready to draw her blood. And we always cleanse with alcohol. Always make sure that the alcohol is dry. Don't ever wave it or take a cotton gauze and wipe it off or let the patient blow on it. That can actually increase our infection rates from our draw sites. So to put these together, I took the cap off the end here and it just twists on. It's threaded. And then we pull our safety back, and whenever we take the cap off of our needle, we always say sharps out. By saying sharps out, this is letting everybody know in the room that we do have a sharps out so that it just, it's needle stick prevention. All right, next thing I'm gonna do is I'm gonna make sure that I anchor my vein really good. Anchoring the vein is just essentially pulling the skin kind of taut. This makes sure that the vein isn't gonna go anywhere, and it's actually been shown to reduce pain for our patients. Now I cleansed right there, so I don't want to touch right where I cleansed, but if I do need to just kind of double check where my vein was again, you can palpate above and below, but never right where you're going to poke. Again, always anchor from below. You don't want to anchor from above and below, because when you go to poke, if your patient jumps, that needle can go right into your finger above it. Big poke. And then we put our tube on here, and it's filling with blood. We got it. Now when I'm all done, the very next thing I want to do is release my tourniquet, and then I want to pull my tube off. I'm going to invert it 1 to 2 times just to mix it. There is anticoagulant in the tubes. And then I'm going to put gauze over it. And the very, very next thing, safety. Click it. You want to hear it click. If it's not clicked, then it's not closed. And go ahead and pull some pressure there. Then we're going to take it and put it in our sharps container. We're going to invert it another 8 to 10 times. When you're using different colored tubes too, it's really important to remember order of draw. It's basically so that we don't contaminate one additive to another in a tube, which could be carried over accidentally. And then once I'm all done, I'm going to check to make sure Kristen is done bleeding, and she is. And then we put a piece of tape over it. Very next thing, before the patient ever leaves, we always label it. We don't ever want to mix up our blood samples with another patient's or anything like that.
Hello everybody, my name is TJ. I'm a medical laboratory scientist at the lab. So after Danielle is done drawing the specimens, she'll send them up to the lab here. And this is our receiving area where all of the blood work comes in. As you can see, we have tons of tubes over here. And then they will take those samples and they will deliver them to analyzers. So if you follow me over here, I'll show you where they load them on. So they'll put them on here, and then they will go down this track, and they will go to their each individual analyzers where they do different tests. So after they get centrifuged. So your blood comes as whole blood in your body, and then when we get it, we spin it down and we separate it into the red cells, and then plasma or serum, depending upon what tests we do. So once it's separated, it goes down the track, and then it'll go to each analyzer. So once it's at the analyzer, and we have several of them going down the line, it does a test dependent upon what your doctor orders. So if for some reason, you're not feeling good when you go to the doctor, they'll order a test. Maybe it'll be a glucose test or something to test your sugars, or maybe it'll be like a CBC to test your blood to see if you have an infection. So once it runs on the analyzer, then we as medical laboratory scientists, we will look at those results to make sure everything looks good and that it makes sense with what's going on with your body. So once we have done that, we will release those results to your doctor, and then he can treat you off of those results.